Hello all, dear parents. So, നമ്മുടെ കൂടെ ഈ വേളയിലുള്ളത് we have Rupesh sir, who is the in charge of occupation therapy and rehabilitation at NHRIMH. We have Archana ma'am, who is working as a behavior therapist at Canada, Ontario. So I am Mary Preezi, speech language pathologist. Commonly, parents chodikkunna questions, and especially when the child is at the verge of diagnosis of autism spectrum disorder. Allengi കുഞ്ഞുങ്ങൾക്ക് autism എന്നുള്ളൊരു diagnosis കിട്ടുമ്പോൾ what they would really like to know. So we hosted a question answer session in our group, and there were a couple of questions that the parents wanted to know, and we are here to answer that for you. So sir, can you tell us more about the multidisciplinary team? അതായത് ഏതൊക്കെ പ്രൊഫഷണൽസ് ആണ് ഒരു ഓട്ടിസം ഉള്ളൊരു കുഞ്ഞിൻ്റെ ഡയഗ്നോസിസിന് പുറകെ വർക്ക് ചെയ്യുന്ന ടീം മെമ്പേഴ്സ്?
Right. So I think there are interdisciplinary professionals, and there are professional involved from developmental pediatrician and psychologist, and then there is speech and language pathologist, occupational therapist is there, even psychiatric social worker is there, and special educator is there as a team member to diagnose the condition. But they all have a different areas of expertise to understand. Like if we talk about a developmental pediatrician, they will see the medical aspect and their developmental history, by which they come into conclusion that from what condition the child is suffering from, that neurodevelopmental aspect. When we talk about a psychologist, they see the cognitive and the behavioral aspect of the child. And for a speech and language pathologist, for them it's like knowing about the language aspect, speech development. For occupational therapist, it's sensory and the motor skills that they will try to understand and diagnose on the basis of that. And social worker is also a part of it, and social workers are basically understanding that knowing the resources part, they try to analyze those aspects, like family aspects also. Sometimes school, they have to visit schools also to understand that things. And the special educator who actually go for the academic aspects, and they try to understand that what are the academic deficit the child is having, and they have to work on.
So ma'am, do you think നമ്മുടെ ഒരു കുഞ്ഞുങ്ങൾക്ക് ബിക്കോസ് എപ്പോഴും ഒരു ഡയഗ്നോസിസ് കിട്ടുമ്പോൾ നമുക്ക് പലപ്പോഴും ഒരു ഈ എല്ലാ പ്രൊഫഷണൽസും ഒരു സെയിം അംബ്രല്ലയിൽ വരണമെന്നില്ല, റൈറ്റ്? സോ സംടൈംസ് വി വുഡ് ഹാവ് വൺ പ്രൊഫഷണൽ or to a professional in a place, എന്നിട്ട് ബാക്കി they might not even find the services. അപ്പോൾ അങ്ങനെ വരുന്നൊരു സിറ്റുവേഷനിൽ what do you think that the child is primarily supposed to have as a therapeutic intervention അങ്ങനെ വരുമ്പോഴത്തേക്കും? Because sir പറഞ്ഞ പോലെ it's very important that we have the children under this umbrella. So if in case അങ്ങനത്തെ ഒരു ഓപ്പർച്യൂണിറ്റി കുഞ്ഞുങ്ങൾക്ക് ഇല്ലെങ്കിൽ ഒരു പ്രൈമറി ആയിട്ട് what do you think immediately they should start off with?
ഇപ്പോൾ സാറ് പറഞ്ഞ പോലെ ഇതൊരു മൾട്ടി ഡിസിപ്ലിനറി ടീം ആണെങ്കിൽ ഇറ്റ്സ് ദ ബെസ്റ്റ് സിനാരിയോ, ബട്ട് ഇറ്റ്സ് എ ഗോൾഡ് സ്റ്റാൻഡേർഡ്. ഈവൻ ഇൻ ഹൈലി അഡ്വാൻസ്ഡ് കൺട്രീസ് ദിസ് ഇസ് ലൈക്ക് ദ ഗോൾഡ് സ്റ്റാൻഡേർഡ് ദാറ്റ് പീപ്പിൾ ക്യാൻ എയിം ഫോർ. പക്ഷേ ഇതൊരു പ്രാക്ടിക്കാലിറ്റി പലപ്പോഴും നമുക്ക് ഉണ്ടാവാറില്ല. അപ്പോൾ വൺസ് so you're asking once you get a diagnosis, like which professional they should start with, right? But I think it kind of depends a little bit on the age of the child also. But kutti valare young aanengil, because these days children are getting diagnosed even under the age of 24 months and under 2 years of age. അങ്ങനത്തെ ഒരു സമയത്ത് we have to focus really on parent coaching, parent training ആണ് കൂടുതൽ. നമുക്കൊരു തെറപ്പി എന്ന് പറഞ്ഞിട്ടൊരു ഒരുപാട് number of hours of therapy is not developmentally appropriate at that time. അപ്പോൾ അങ്ങനത്തെ ഒരു സമയത്ത് I feel it is more like if you have a behavior therapist who can go into the child's home and train the parents, which whoever is the professional, parent trainingന് കുറച്ചും കൂടെ പ്രാധാന്യമുണ്ട് അവിടെ. കാരണം child is at a very early stage of development. അപ്പോൾ whoever is going in, whoever is available, whether it's OT or behavior therapist, really to focus on family routines, എന്താണ് ഫാമിലി പ്രയോറിറ്റി, എന്താണ് വാട്ട് കൈൻഡ് ഓഫ് ലാംഗ്വേജ് ആർ ദേ യൂസിങ് ഇൻ ദ ഹോം, ഹൗ ക്യാൻ വി എൻഹാൻസ്. more than anything else, especially because it's autism and it is a deficit in social interaction at the end of the day.
Yeah.
Really, truly, that is the core, right? It is a deficit in social interaction. Any professional poyalum, they should truly focus on enhancing the parent-child interaction. So instead of naming a professional, I would say whoever is
Right.
available and has a capacity to interact with the child and family, please focus on the social interaction. Don't just say that, I'm a behavior therapist, I will only look at this. I'm an occupational therapist, I will only look at this.
Very
But
true.
look at the interaction, how to enhance, because
Right.
all these professionals have been trained to look at development. All these professionals are trained how to play with children, how to interact with parents. So that is what I would say in a long answer, that whoever goes in, focus on this aspect. Absolutely.
So I think, like how you all mentioned, the holistic development of a child is very important, and I think every professional equally have major role to play in there, and everybody has their own weighing scales there, so it's not like high and low anyways. Okay, that's very good to know. And moving on, so very many times we have parents coming in and telling us, like, കുഞ്ഞ് ഒന്നര വയസ്സ് 2 വയസ്സേ ആയിട്ടുള്ളൂ, ആൻഡ് ഐ ഡോണ്ട് തിങ്ക് കുഞ്ഞ് ഇസ് പ്രിപ്പയർ ടു ഗോ ഫോർ എ തെറപ്പി എന്നുള്ള കോമൺ ക്വസ്റ്റ്യൻ ആണ്. 2 വയസ്സാകുമ്പോഴത്തേക്കും ആക്ച്വലി തെറപ്പി കൊണ്ടുവിടണോ? Okay, so what do you think, ma'am, is the correct age for them to actually start off with therapy?
So when you look at a child who is, say, a year and a half to 2 years, already our developmental, a child from 0 to 2, how fast that child develops in all aspects, when you look at it, right, from a developmental perspective, so much has to happen. അപ്പോൾ അവിടെ എവിടെയെങ്കിലും ഒരു ഡിലേ വന്നു കഴിഞ്ഞാൽ catching up is a very difficult game.
Right.
അപ്പോൾ if at all there is a capacity for the parent, I would say that start early. Even if you don't have a diagnosis, you only have red flags. സംശയമാണ്, ഡൗട്ടാണ്, എന്നാലും go visit a therapy center, talk to a professional and do something, like start with something. It could just be that you don't have to go for therapy every day, but it could be like, at least once a week. Let the child be with other children, interact with other children. So I would say the moment you have a doubt, do not delay, because 0 to 3, 0 age to 3 years, the development is like unbelievable, right, sir? Like in terms of the human brain and
Right, very right. In fact, I would like to say that the term that early intervention has come because of that only, what ma'am is saying, and that 18 years to 24 months, is the age where we get the maximum development of brain. It has been said that 90% brain develops at that time only.
Absolutely.
So what ma'am is saying is perfectly all right, and the thing is that whatever, even for one day also you are going to a center, you come to realize so many things, like what ma'am said about the social aspect. Even if the therapist is saying that you must take care of the social aspect, the parenting changes after that. So it is very helpful if it started at that time.
That's right. Okay, I think early intervention has a significant role to play.
Absolutely. Absolutely.
That, when children, we totally understand that the early intervention പറയുമ്പോൾ first thing that comes to a parent's mind is കുഞ്ഞിനെ ഒരു അറിയാത്ത സെൻറ്ററിൽ വിടുമ്പോൾ won't they start crying? Okay, പക്ഷേ just not being biased by my profession, but I would say that cry is a primary way of communication. That's the way that the child starts expressing too. So our expression കുഞ്ഞിന് initially വരുന്നില്ലെങ്കിൽ, so very many times we see children on the spectrum who are not even able to express their emotion, not that they don't have it, but just that our expression വരുന്നില്ലെങ്കിൽ, then it's really difficult for the parent after one point of time. Yeah, so like how ma'am and sir you had mentioned, so this early intervention plays a very, very significant role in it.
And also one thing what you have said, that when the child come early, and what parents are complaining about, that the child is crying or something like that at that particular age, then handling is also one important thing for the therapist. Like how the therapist handle the child, it matters. And there are therapists who are handling quite well. In fact, once the child come to the center, the way they handle it, the child is not feeling any kind of fear because that what thing you are saying is about fear only.
Absolutely, yeah.
That fear comes to the child when a child comes to a center and is surrounded by few people who are doing something on it, him. So handling is the important aspect, how the therapist handles it, and how the child feels secure and safe in a center. So that also need to be communicated to the parents,
Definitely.
that we are trained in that.
Yeah, and for the parent to see that, a 2-year-old will not be put at a table and given certain tasks, right? It's all about relationship building,
Correct.
building trust, having fun with the child, so the child feels safe and calm. And of course, the parent also should feel that my child is safe here, the child is having fun. So it's, when we say therapy, I know how it feels like, people are wearing white coats and walking around. It's not, it's well-trained people are a lot of fun for little kids. And so the warmth will be there, the child's needs will be met.
You're right.
Yeah.
So moving ahead, sir, so very many times, like, I've had, as a professional, or my team also has had this confusion, and I'm sure a lot of parents have asked, is this a behavioral problem, or should I name it as a sensory issue? Kore parents choichittunde. So sometimes nammade professions like when an OT-C8 avarikku probably sensory ennaanu differentiate cheyan pattum from a behavior, when a BT-C8 avarikku പക്ഷേ ഒരു parent's point of view ന്ന് ഒരു കുഞ്ഞിനെ കാണുമ്പോൾ it's just about my child, I don't know if it is this, I don't know if it is that. In that kind of situations, how do you differentiate a sensory issue from a behavioral problem?
Right, it's a very good question actually. And like when we talk about behavioral problems are basically due to the want and the need of a child. And when we talk about sensory problems, it is about some trigger that is in the form of touch, that is in the form of light, that is in the form of sound, or any other sensation, like sometimes it can be olfactory also. So we have to understand the trigger. What is the trigger? As a parents need to know that when these behaviors started, what was the trigger? Is there was any sound sensation that has created such kind of behavior? Is there a light sensation that created that kind of behavior? So if we can understand that, if we can check it as a parent also, as a therapist also, then we can be easily able to differentiate between whether it is a behavioral problem or a sensory problem.
So yes, ma'am, with respect to sensory and behavioral differences, I think sir gave a very valid and a very, a point where the parents can actually look into, May I know what is your point of view, ma'am, from that?
Yeah, so when it comes to problem behaviors, right, because sometimes when we think about problem behaviors, we look at it, the different functions. എന്തുകൊണ്ടാണ് ഇത് സംഭവിക്കുന്നത് എന്നുള്ളത്. അതിനകത്തൊരു മെയിൻ റീസൺ സെൻസറി നീഡ്സ് ആണ്. അതായത് ഒരു കുട്ടിക്ക് ഇപ്പോൾ ചില സമയത്ത് ഞാനിപ്പോൾ ഇട്ടിരിക്കുന്ന കോട്ടൺ ആണ്, അത് കുറച്ച് റഫ് കോട്ടൺ ആണ്, പല കുട്ടികൾക്കും ഇത് പറ്റില്ല. സോ they will resist it, right, and it will look like it is a tantrum behavior, but really what's happening is that it is rough and it is really bothering the child, so they start crying. So as sir said, we have to be good observers as adults and parents. Observe it, we have to look at patterns. Anytime I wear this kind of a fabric for the child, this behavior is happening. So that is triggering the behavior, right? അപ്പോൾ ഇതിന് ഒരു പെട്ടെന്ന് നമുക്കൊരു ഇത് സെൻസറി ഇഷ്യൂ ആണ്, ഇത് ബിഹേവിയറൽ ഇഷ്യൂ ആണെന്ന് ഒറ്റ നോട്ടത്തിൽ പലപ്പോഴും മനസ്സിലാവാൻ കുറച്ച് ബുദ്ധിമുട്ടാണ്. But once you observe a little bit, you look at the patterns, you will know this is bothering the child. Or a child will come walking into this room with bright lights and will immediately run out, for example. ഇങ്ങനെ ചെവി പൊത്തി പിടിച്ചിട്ടോ അല്ലെങ്കിൽ കണ്ണടച്ചിട്ടോ might run out. Might still sit here looking at that fan which is going around. So maybe he is getting that, loving that sensory input, right? It might look like the child is not paying attention to class, but he's focusing there. So it's not that he's not interested in the class, but he really wants that input. We have to be good observers and look for patterns, because the child cannot tell us. this is my
Yeah, right,
issue.
right.
Always looking for patterns, looking for triggers, what happens before the behavior. Yes.
But I think that's something that parents actually can start looking into, even if they, if they have a child, be it typical or if it is neurodiverse. These are certain things that parents can actually look into.
Yeah.
And
that
in
is, yeah, go ahead.
autism, sometimes routines are very important.
Yes.
Like there is a change in routine, and we find that there is a behavioral problem. That is also one thing that happens. I think ma'am will tell more about it.
Yeah, definitely. A lot of times children with autism, I mean, it's not part of a diagnostic criteria, but we end up seeing that children with autism love certain patterns, certain routines, etc. And if there is a change in the routine, they get very upset. And in those situations too, again, to be conscious about what change has happened in the routine. And see, we cannot keep the routine perfect all the time.
Right.
Life is not like that, right? So how do we train the child to be open to a certain routine? So for example, I have many clients who go from their house to the school in their father's car, or mom is driving, but the mother has to take the same street every time. If
Right.
due to some reason that street is closed,
Right.
and mother has to take another street, that's the end of the day. Huge tantrums, etc. It becomes very much a routine behavior. So that becomes a behavioral challenge. But at the same time, because a lot of the children love routines, we can teach them a lot through routines. We can make their day more active and predictable by
Right.
giving them routines to do. Okay,
Right.
first this happens, then this happens, and then maybe you have a choice. Do you want to do this or do you want to do that, right? It works both ways. Sometimes it becomes a
Right.
behavioral issue, but sometimes it can become an advantage. Then we can teach the child, this happens first. First you fold your clothes, then you put them away, then you put your socks on, then you go to school. Like things like that we can teach them. So it is both ways.
It's that's really very, very informative, because the routine, if the child is not falling into a routine, we know how devastated a parent's day can be. Because I've seen children who've come to us with no routine and they don't know what has to be done next. So very many times for children with autism, what I've seen is they're very much predictable. Okay, if they have that and they anticipate this is what is going to happen, and if that doesn't happen in that way, we know how difficult it will be for the child, for them to relate to their environment, for the parent to actually take care of their entire thing is really difficult.
And good thing about that is that routine helps also in therapy also. Like as a therapist, if we are able to train the parents in those areas, then probably for us also it is a lot of help.
That's right.
Our things are simplified after that.
That's right.
Absolutely. So for the parent and for the child, there'll be a structure. So the child becomes successful,
Right.
and the parent will also feel, wow, I did 1, 2, 3, 4 with my child today. The day was good. Because otherwise, if it is not a structured way of living, day in and day out, you feel at the end of the day, for any person, right?
Yeah.
Like, what did we achieve today? But whereas it's like, oh, I could do this with my child. Could I do 5, 6, 7, 8, 9? No, but that's okay. So that sense of achievement, sense of we did something together.
Makes a huge impact in their
does,
life,
yeah.
right? So I'm sure from your expertise, I'm sure that you would have seen a lot of parents who actually have, after the diagnosis of autism, how their emotional state, you've seen it in your expertise. So if a child is diagnosed with autism, what do you think that the parents have to do at that point of time? Because I know it's an emotional breakdown though, but what do you think the next step they'll have to take for it?
I think the first important thing as a therapist we have is to make them understand that look, you have to accept what it is there, right? Many of the parents in India, when they come to know the term about autism or any other level, they feel devastated at that time. They are not ready to accept it, and sometimes what happens that they think that they want to change them completely. They want to make them normal. That is one aspect. So we can have a kind of approach where we can make them understand what autism is. We can make them understand that what neurodiversity is, what neurotypical is. And in fact, many a time, when the patient comes to me, I tell that, look, people are saying that your child is neurodiverse, but I am telling that all of us are neurodiverse. Right. Nobody is neurotypical.
Yeah.
Like it's basically a society framework where we put a certain amount of people, which is the majority, in a neurotypical category, and rest 10% in the neurodiverse category. So there is no point thinking about that, and no, even the way you think, I don't think the way for the same thing. So it's you should not think about that your child is different also. We all are different, we all are unique, but in that way somehow we have to understand that what is the need of the child, and as early as possible, if the child is coming maybe within 3 years, that is good for the child also, good for us also. So we should start that intervention part as early as possible. We should try to work on those areas, and we should have some some kind of interactions, or you can say some kind of liaising with the schools also. Because most of the parents are having complained that they are not able to go to the school after certain year of attaining a certain age. So I think here not only our therapy, but all all stakeholders should work to go together, so that for every of people, especially for the autistic child, I think the things are settled.
That's right.
That is what I feel. So making them understand about the condition, accepting that this is going to be there, and in this condition only they have to maximize the child potential. So that is one goal that I always keep in my mind.
That's right.
I would just add to it.
Yeah.
I mean, I think you said it so beautifully. This is something that one of my supervisors told me. They said, Archana, remember, you're working with parents. This is a marathon for them, right? This is not a sprint. So as a therapist also, I shouldn't be like, okay, let's do this. But it's like, it's a lifelong, it's a marathon. So endurance, right? Like you have to support the parents to go the long way, to go the long distance rather than a 100-meter run. How do we support parents to do like a marathon which can go on for days and weeks together as a marathon, but in life it is even longer. So I often feel that how can we support the parents in that, because they shouldn't get burnt out. Because usually as soon as we get a diagnosis, it's like, okay, how do we change things? How do we make this typical? How do we make it normal? And it's completely okay. I think a lot of parents will go through it, but it's about how do we take care of ourselves in the process as well, because this is a very long distance, and how do we get our support systems in place. So don't just suddenly say, it's me and my child and my partner, and let go of all your relationships with your extended family, etc., because you will need all of them. Don't let go of your friends thinking that they might not understand. Don't let go of them. We need all of that for the long distance.
That's right. I think from a very early time, we keep teaching the parents, it's about the child being independent. It's not about fixing. It's about helping the child, but at the same time walking towards an independence, because once the child is independent, then at least they can take care of themselves, and they don't require a lot of support. Very many times when we have a difficulty or we have a condition, like for example a sprained hand or a leg, what happens is we require support. So eventually we match that to the child's actual problem, or where we call it as neurodiverse condition. So ma'am, what do you think are the early signs of autism? Like a parent, what should they be looking into, especially when the child is 6 months or 1 year of age? What do you think that the early signs of autism would show up in children?
There's a lot of research now, right? A lot of information has been gathered over the years as to what these signs and symptoms are. I will highlight just a few. The predominant thing is eye contact for attention.
Right.
That is a very crucial thing, and please both of you join as I'm speaking. Is that it's not just eye contact for the sake of eye contact, right? Like we're not just increasing eye contact for longer duration. No, it's not about it. Even when the child is just a year, 12 months of age, so if I am sitting with my child who is 12 months of age, just 1 year old, and I'm rolling a ball back and forth, ഇങ്ങനെ കളിച്ചുകൊണ്ടിരിക്കുന്ന സമയത്ത് പെട്ടെന്ന് ഞാനിങ്ങനെ ബോൾ ഇങ്ങനെ നടുക്കിൽ വെച്ചിട്ട് ഞാനൊന്നും ചെയ്യാണ്ടിരുന്നാൽ ആ കുട്ടി ആ ബോളൊന്ന് നോക്കും, പിന്നെ എന്നെ നോക്കിയിട്ട് what's going on എന്നുള്ളൊരു എക്സ്പ്രഷൻ വരും മുഖത്ത്. We'll look at my face as a parent, we'll look at my face and what's going on, do something about it, you're supposed to throw the ball to me, right? അപ്പോൾ it is the eye contact to get my attention that don't you think that something's going wrong here, the ball is not coming to me എന്ന് പറഞ്ഞിട്ട് അപ്പോൾ ആ ലുക്കിൽ then I understand the child is communicating, they want more. So eye contact as a attention seeking or a communicating factor. പിന്നെ മെയിൻ ആയിട്ടുള്ളത് വാട്ട് വി ഫർഗെറ്റ് ഇസ് ദാറ്റ് ചിൽഡ്രൻ ഹാവ് എ ലോട്ട് ഓഫ് പ്രീ ലിംഗ്വിസ്റ്റിക് സ്കിൽസ്. അതായത് ലാംഗ്വേജ് ഡെവലപ്പ് ചെയ്യുന്നതിന് മുമ്പ് ഒരുപാട് ജെസ്റ്റേഴ്സ്, ലൈക്ക് മീ ഐ യൂസ് എ ലോട്ട് ഓഫ് ജെസ്റ്റേഴ്സ്. സോ ചിൽഡ്രൻ യൂസ് എ ലോട്ട് ഓഫ് ജെസ്റ്റേഴ്സ്. അപ്പോൾ കുട്ടികളാണെങ്കിൽ ചെറിയ ബേബീസ് തന്നെയാണെങ്കിലും കൈ ഇങ്ങനെ കാണിക്കും ഇല്ലേ. അപ്പോൾ ഇത് പലപ്പോഴും കുറവായിരിക്കും ഓട്ടിസം റെഡ് ഫ്ലാഗ് ഉള്ളത്. അതുപോലെ തന്നെ ഞാൻ ആദ്യം പറഞ്ഞ കാര്യം ഐ കോൺടാക്ട് ഫോർ അറ്റൻഷൻ, അതും വളരെ കുറവായിരിക്കും. ഇല്ല എന്ന് പറയില്ല, പക്ഷെ കൺസിസ്റ്റൻ്റ് ആയിട്ട് കാണിക്കില്ല. ദേ വിൽ നോട്ട് ഷോ ഇറ്റ് കൺസിസ്റ്റൻ്റ്ലി. സെയിം തിങ്സ് ലൈക്ക് ജസ്റ്റേഴ്സ് ലൈക്ക് ദിസ് ഓർ ഷേക്കിംഗ് no or yes, അതൊക്കെ ഈവൻ ബൈ 12 months they have it. പിന്നെ പലപ്പോഴും കുട്ടികൾ ഇങ്ങനെ കൈ ഇങ്ങനെ കാണിക്കും to show whatever is in their hands. This behavior is also not consistently shown. അപ്പോൾ gestures കുറവായിരിക്കും, പോയിൻറ്റിങ് കുറവായിരിക്കും. ഇറ്റ്സ് ഓൾ പാർട്ട് ഓഫ് ജസ്റ്റേഴ്സ്, പ്രീ ലിംഗ്വിസ്റ്റിക് സ്കിൽസ്. ഇത് ലാംഗ്വേജ് വരുന്നതിന് മുമ്പ് കാണിക്കുന്ന സ്കിൽസാണ്. ഇത് കാണിക്കണം, ഈ സ്കിൽസൊക്കെ കാണിക്കണം കുട്ടികൾ. അത് കുറവായിരിക്കും. പിന്നെ നമ്മുടെ ജസ്റ്റേഴ്സ്, ഇഫ് വി പോയിൻറ്റ് ടു സംതിങ്, ഈസ് ദ ചൈൽഡ് പോയിൻറ്റ് ഫോളോയിങ് ദ പോയിൻറ്റ്, ഓക്കെ, അത് കുറവായിരിക്കും. ഇപ്പോൾ ഇതൊക്കെയാണ് മെയിനായിട്ട്. പിന്നെ റെസ്പോണ്ടിങ് ടു നെയിം, അതും വളരെ ഇൻകൺസിസ്റ്റൻ്റ് ആയിരിക്കും. ടു ദ എക്സ്റ്റെൻറ്റ് ദാറ്റ് സംടൈംസ് പാരൻസ് ഫീൽ എൻ്റെ കുട്ടിക്ക് കേൾക്കാൻ പറ്റുന്നില്ലേ. അപ്പോൾ നമ്മൾ ആദ്യം കൊണ്ടുപോകുക ഹിയറിംഗ് ടെസ്റ്റിന് വേണ്ടിയിട്ടാണ്, റൈറ്റ്. അത് അവിടെ നിന്നാണ് പിന്നെ മേ ബി ഇറ്റ് ഇസ് എ ഫീച്ചർ ഓഫ് ഓട്ടിസം എന്ന് വരുന്നത്. അപ്പോൾ നോട്ട് റെസ്പോണ്ടിങ് ടു നെയിം ഇസ് എ ബിഗ് റെഡ് ഫ്ലാഗ്. നോട്ട് ഷോയിങ് ഐ കോൺടാക്ട് ടു ഗെറ്റ് യുവർ അറ്റൻഷൻ ഈസ് എ ബിഗ് റെഡ് ഫ്ലാഗ്. നോട്ട് ഹാവിങ് ജസ്റ്റേഴ്സ്, നോട്ട് റെസ്പോണ്ടിങ് ടു ജസ്റ്റേഴ്സ് ഓഫ് ദ പാരൻസ്. പിന്നെ ഇമിറ്റേഷൻ സ്കിൽസും പലപ്പോഴും വളരെ കുറവായിരിക്കും. അഗൈൻ ബേബീസ് ബൈ 12 months they are imitating a lot. അതും കുറവായിരിക്കും. അപ്പോൾ ഈ കാര്യങ്ങൾ ഉണ്ടെങ്കിൽ യു ഡെഫിനറ്റ്ലി ഹാവ് ടു സ്റ്റാർട്ട് ഇൻവെസ്റ്റിഗേറ്റിംഗ്.
ദാറ്റ്സ് ആക്ച്വലി മാം പറഞ്ഞത് ഭയങ്കര ആക്ച്വലി കറക്റ്റാണ്. ബിക്കോസ് അവിടെ വാട്ട് ഹാപ്പൻസ് ഇസ് ഞങ്ങളുടെ അടുത്തോട്ട് വരുന്ന ഒരുപാട് പേരൻസ് സ്പെഷ്യലി മേ ബി ഒരു സ്പീച്ച് ഡിലേ ആയിട്ടായിരിക്കും വരുന്നത്, ജസ്റ്റ് ഹാവ് എ സ്പീച്ച് ഡിലേ. പക്ഷെ ദേ ആർ സോ ഓവർവെൽംഡ് ആൻഡ് ദേ ഡോണ്ട് നോ വാട്ട് നെക്സ്റ്റ്. അപ്പോൾ അവർ പോയി ദേ ലുക്ക് ഇൻ ടു ദി ഇൻ്റർനെറ്റ്. അപ്പോൾ ഗൂഗിൾ ഹാസ് എ ലോട്ട് ഓഫ് ഇൻഫർമേഷൻ. ഐ തിങ്ക് presently we have ChatGPT, which is giving us a lot of information. ഇതെല്ലാതും is for the good of it. പക്ഷെ what happens is parents get so overwhelmed by this thing and അവർ പോയി റിസർച്ച് ചെയ്ത് they come up with own diagnosis. And then what happens is ഒരു സ്പീച്ച് ഡിലേ ഉള്ള കുഞ്ഞിന് പോലും I've seen very many parents coming and asking me autism ഇല്ലല്ലോ. That actually puzzles me. I mean, why autism illallo ennu choikkumbo polum they have that, autism illallo. And I mean, I don't understand. It's good to know about it. Ipo namakayikku thalavena vannu kayinja when we look into the internet, it can give you n number of results. I've seen some people even going to the stage of saying that I have a big condition because of a small headache.
That is a stigma also. I think the social response to a particular thing, like in mental health also we see, and in neurodevelopmental condition also we see, the way the society, that collective thinking is there about a particular condition which is having a mental health issues, it reflects on the parents,
Definitely.
So parents, sometime what you are saying is absolutely correct. I mean, they come up with this and they ask whether autism is there or not.
Yeah.
They just want a no from you at that time. So this is one thing.
But right now I kind of feel a lot of professionals who are just coming out of the out of colleges. One thing that I've noticed personally is that they are pushed to say no, your child doesn't have autism, even though they see the red flags, even though diagnostic criteria like DSM-5 shows that yes, autism with a supportive level of this is there. They are forced to say that no, your child doesn't have autism. And I've seen a lot of parents buying this. They say that okay, this professional told me that my child doesn't have autism, so I'm going to go only to this professional. That person actually told me my child has autism, so I'm not going to that professional. So the stigma is actually increasing day by day. I think the awareness has to go, I feel at this point of time it has to go like wildfire. Because last 2 days ago when I was just looking into the the ratio of number of children with autism, it says that 1 in 36 children are diagnosed with autism. And that is so puzzling, it's so alarming. So the awareness versus the increasing ratio is actually really alarming.
For that, I think I would like to add few things. Like the way DSM has changed. DSM like 1, 2, 3, 4, 5. It came
Which is the diagnostic manual.
So diagnostic manual has changed a lot, and it has created a lot of condition like that also. Like,
Yes.
because there was a time when this criteria was not there. So at that time the number of patients were less. I mean the diagnosis of autism were less. But now since the clarity has come, so it is more. So that is one of the thing which I feel is adding to the number of cases.
Right, that's definitely, yes, I'm sure, because, and not only that, this increasing cases is actually having a the parents who are even expecting children, everyone's very conscious, and they are like, they start praying that, oh my god, I just require a typical. Earlier it was, we've seen earlier, I want a boy child, I want a girl child, but right now it's like, I want a normal child, and I think that's actually the prayer of most children. Yeah?
And one more question that you asked, that just now with this only you told that the professional is saying that your child is not having autism. So there is a concept here, what I feel in India, I can say, because I have not seen how it is practiced in overseas. Ma'am will tell about that there is two aspects of the things. There are professionals who will say that it will be completely cured. Right? They will not say that it is autism, what ma'am has said, that it's a marathon, you have to endure it for a long period of time, and the patient, the parents will buy that because they will feel that they will cure it. Right? So this is one of the reason why the parents are thinking about that.
That's right, ma'am. I mean, is it the same way overseas?
It's a little bit different. It all depends. So see, the diagnosis is interesting, right? Because we don't have a blood test.
Yeah, true.
For autism, or you can pull out something and look under a microscope. It is autism diagnosis is based on observation and parent input, right? We do interviews, we do observation, and then we have criteria based on the DSM, which is the diagnostic manual. So because of that, there will be some subjectivity will come in, but at the same time, the social context also makes a difference. As you said, right now, like people are really worried about the diagnosis, getting a diagnosis. So quite a few years ago, like 10-15 years ago in Ontario, I would say 20 years ago, it was the same scenario where parents would say anything but autism diagnosis, please, like it could be anything but. Then what happened is that the Ministry of Children and Youth Services in Ontario started funding autism treatment fully. Okay, so it was like you have a diagnosis and you start getting your treatment immediately with a lot of funding. Then slowly it changed to, okay, if my child has a diagnosis of autism, there is still hope because I'll get treatment immediately. So then parents became less resistant. So again, like one of the psychologists I used to work with, he would say that where there is funding, there is diagnosis. So if a specific diagnosis gets more funding, more support, we usually see an increase in that diagnosis because there is more hope. So the doctor would say, I really think it is autism, I'm not 100% sure, but it's okay to give that diagnosis because the child is going to get treatment immediately, and maybe when the child comes back for a revisit, things might look different. So there is no harm in giving that diagnosis sometimes, right? Yes. So diagnosis is never a standalone. I find that it has a lot of other aspects to it, societal, economic, how professionals look at it now, etc., etc. So that I found fascinating because I have lived through that phase for more than 20 years in Ontario, and when the funding came, how things changed and how the hopes, everybody was more hopeful and parents got more support, etc., etc.
That's very nice to know. I hope things change too.
Things will change,
eventually.
It can only change, can only go up, get better.
That's right.
They come a long way.
Yeah.
definitely come a long way. Like we wouldn't have a discussion like this a few years
Exactly,
ago,
that's right, that's right.
Yeah.
Ma'am, lastly, to add on to our this very valuable conversation, let's give the parents a little more light upon the importance of parents in the treatment of autism. What is their relevance? Is it a high relevance? Is it no relevance? Or is it low relevance? What do you think, ma'am?
I would say it is the highest relevance.
Very true.
And not just in treatment, but right from diagnosis, right? Because as I said, when somebody is diagnosing a child, our information comes a lot from talking to the parents, a lot from observation, not just at the clinic, but from parent observation too. So right from that early stage of diagnosis, parents are crucial. And then we know for child development, even a child with autism, the child is still a developing child. It's not an autistic child, it's a developing child. And for child development, parents are needed. Therapists cannot look after child development. They can support, they can fill in some gaps, but hey, child development is in the hands of parents. They have to take that on. And therapists have to realize that that's the only way. Like I can only do maybe 5 sessions a week. Parents are with the child 24/7. I might be there only for the first 6 years of the child's life. Parents are there till the child is 16, 26, etc. Right? So highest relevance. So if sometimes I've heard, unfortunately, not just in India but all over the world, that there are some centers where the parents are not allowed into therapy sessions. I would say don't do it then. Parents have to be part of the therapy sessions. They have to have a lot of interaction with the therapist. They have to see what the therapist is doing, try to bring it into the home, and vice versa. They can tell the therapist. So for example, when we teach, right, I'm talking about Ontario, an English speaking province, and it's like when we teach the child food items, we might teach, bread, the typical like cake and things like that. And sometimes parents would say, no. At home we predominantly eat roti, rice, etc. So teach the child that. Okay. So that is how parents can be. Or, they don't call father dad. They might call father something else, right? So instead of saying, where is your dad? The child will only know if I say, where is your baba? So I need that input from the parent, right? Because it doesn't make sense for the child to say, where is your mummy? No, where is your amma, right? So we need to know what is happening at home. We need a lot of interaction from the parents. And of course, the parents can take the skills and support the child to show the skills in the rest of the home, rest of the environment, etc. So I'm very, very passionate about this topic, that both ways. Parents have to be involved. Therapists have to be really good at involving the parents too. We cannot say we know it, the child will be great with us. No, that doesn't matter much. Child will be good with you because you are trained. But now, how do we support the parents?
That's right.
So actually putting enough effort, just like you're putting in effort for the child, put effort to involve the parents, and things will go so much better.
So like what ma'am has said everything, but I would like to add, like what ma'am has said, it's a cultural context that is very important.
Yes.
And cultural context is not possible without taking in consideration of parents, because we are working in a different environment, and we don't know if in a place like India, like it is told that in every 10 miles things changes.
Yes.
Right.
Yes.
Right. So we have to understand that in what culture the child is growing in, and in that way we have to train them. So that's very, very important aspect.
So I think this question answer session is the helpful ആയെന്ന് ഞങ്ങൾ വിശ്വസിക്കുന്നു. And ഞങ്ങൾ ഇപ്പോൾ ഡിസ്കസ് ചെയ്ത questions are just a few questions, because പേരൻസ് ഫ്രീക്വൻ്റ് ആയിട്ട് നമ്മുടെ വാട്സപ്പ് ഗ്രൂപ്പിലും അതുപോലെ തന്നെ ക്ലിനിക്കിലും വന്ന് ഫ്രീക്വൻ്റ്ലി ചോദിക്കുന്ന ക്വസ്റ്റ്യൻസ് ആണ് നമ്മളിന്നിവിടെ ഡിസ്കസ് ചെയ്തിട്ടുള്ളത്. ഐ ഹോപ്പ് ദിസ് ഈസ് റിയലി ഹെൽപ്ഫുൾ ഫോർ യു ഓൾ. നിങ്ങൾക്ക് ഇനി എനി ക്വസ്റ്റ്യൻസ്, എനി ക്വയറീസ് നിങ്ങൾക്കുണ്ടെങ്കിൽ പ്ലീസ് ഫീൽ ഫ്രീ ടു കോൺടാക്ട് us, and then we will help you out. And remember, ഒരു കുഞ്ഞിൻ്റെ ഡെവലപ്മെൻറ്റിലെ എല്ലാ റെസ്പോൺസിബിലിറ്റീസും ഇറ്റ്സ് ജസ്റ്റ് the parent, because you are building your child to be independent to the end of the day. So if you have any more queries, do feel free to contact us. Thank you.